Back everyone. Let us see the rapid read set 9, which includes both cross-section as well as conventional images. So let us see. Classic appearance, MRI, T1 and T2 weighted coronal images of hip joints. So this is classic serpiginous hypointense lesions here on right head of femur as well as left side. You can see minimal joint effusion on left side, and you can see some hypointense areas compared to right side because the aggressiveness on left side is more. So this is bilateral avascular necrosis of both hips. Most likely the patient might be alcoholic or a patient might be on steroids. Always try to look and assess the risk factor for AVN. Another important spotter which is usually kept in the exams and which we need to look regularly, chest x-ray, or this is actually a topogram. What is missing here? Yes, exactly, the left breast shadow is not seen. This is a case of post mastectomy on left side. Came for CT chest screening to look for metastasis. The main reason for keeping this image is to identify the post mastectomy x-ray. Another classic one, young female or middle-aged female with severe headache, vomitings, dehydration might be the risk factor. So always look for the hyperdense sinuses. So this is the hyperdense sigmoid sinus, and even in this patient the transverse sinus was also hyperdense, which is suggestive of venous sinus thrombosis. And never forget to always look at the cella in the axial sections. You might see incidental macroadenomas. Young male, fever, cough. Although it's a spotter, I'm just giving a clue. So this is a classic miliary pattern. You can see the multiple scattered opacities which are round and uniform in size. These are very important. Uniform in size, round and bilateral, scattered, symmetrical. So this is a miliary pattern. This patient is proven to be miliary tuberculosis. This patient also had liver lesions. Another classic, elderly patients, multiple lesions in the spine. Yes, it could be. First possibility should be metastasis. You can see multiple variable lesions. You can see variable size lesions. You can see the altered marrow signal intensities of all vertebrae. You can see multiple hypointense lesions on T1 as well. So this is a case of metastasis, but the differentials include the lymphoma and multiple myeloma. Thank you all.